Hello and welcome back to T1D Academy. My name is Harold and my son Liam and I are really glad that you're here. In this video, we're going to talk about what typically happens during the hospital stay following a type 1 diabetes diagnosis. What that time is actually used for, what individuals and families are expected to learn while they're in the hospital, and then try to get you prepared for life outside the hospital walls. As I thought about which video I should make next, I kept coming back to those first days in the hospital because I remember the knowledge and skills that I acquired during the 5-day stay as really just a blur. What stands out mostly to me is how the hospital staff did their best to bestow the essential knowledge and skills in such a way that would be helpful, but what I remember is a mass information dump into my wife's and my brain. And still feeling vastly unprepared for what I'll call life on the streets outside of the hospital walls. And the interesting thing is this. Even years later, if you asked me to list everything we learned during that 5-day stay, I don't think I could do it in one sitting without really thinking it through slowly. Not because it wasn't all important, but because it was dense, it was structured, it was compressed. The hospital staff understood the schedule of discussions and trainings and all that, but we didn't. That realization is what made this video next to be the next logical video that I made. Because the hospital stay is foundational. It's where the base skills are built. It's where insulin therapy begins. It's where monitoring routines are established. But it's also delivered at a pace that doesn't leave much room to slow down and absorb each piece individually and comprehend them fully. So my intent in this video and the entire series of what I'm calling the Hospital Stay Following Diagnosis series is to break that hospital stay apart and dissect it and lay it out in such a way that it's slower and more consumable. We're going to walk through what time is used for at a high level in the hospital during that stay, clearly and in order. And after this video, I'll be creating separate standalone videos for each aspect of what's learned during the hospital stay. Each topic will get its own space: insulin, finger sticks, ketones, food, lows, highs, sick days, devices, on and on and on. You can understand each concept in detail at your pace with the ability to pause and process in a way that simply isn't possible in the hospital setting. So let's get started. The first and primary priority during that initial diagnosis hospital stay is medical stabilization and monitoring. Insulin therapy is started to replace or supplement the insulin the body is no longer able to reliably produce on its own. In some cases, especially early on, the body may still be producing varying amounts of insulin during what's known as the honeymoon phase. Because of that, insulin dosing during this time is carefully adjusted based on the real data collected in that controlled environment. This is usually done using a basal bolus approach, which means insulin is provided both to cover the background needs and to handle the food and the high blood sugars with the bolus insulin. These initial insulin doses are intended to serve as baseline starting points, based on careful observation and real data collected by the hospital staff. Blood sugar is checked frequently during this time using fingerstick testing with a traditional blood glucose monitor, referred to as a BGM. These fingerstick readings are data the medical team relies on to make insulin and treatment decisions during the hospital stay. Ketone testing and monitoring is also part of the hospital stay, especially if blood sugars were high and ketones were present upon admittance to the hospital. Individuals and families are introduced to what ketones are, why they matter, and why their presence signals that the body isn't getting enough usable insulin. At this stage, the focus is on awareness and early response. Understanding that ketones require attention and hydration and insulin play a role in clearing them, and that ketones can escalate into serious condition if they're ignored, condition known, which I previously mentioned as diabetic ketoacidosis. The goal during the hospital stay is not mastery, but it's recognition and knowing what ketones are and understanding that there's something that requires prompt attention or medical help. We'll go much deeper into ketones and DKA in a dedicated video specific to that topic later in this series. Many people also receive IV fluids during the initial phase of their care. This helps correct dehydration and electrolyte imbalances that can occur when blood sugar has been high for an extended period of time. Vital signs are monitored regularly by nursing staff as part of routine inpatient care, helping ensure that the body is stabilizing and responding appropriately to the new treatments. Alongside the medical stabilization, a large portion of the hospital stay is dedicated to education and hands-on training. Individuals and families are trained on how insulin is administered, whether that's using insulin pens or syringes. This includes learning injection techniques, site selection, and site rotation. During the same time period, many people are also introduced to diabetes technology, including continuous glucose monitors, or CGMs, as well as insulin pumps. While neither CGMs nor pumps are typically started during the initial hospital stay, patients and caregivers are often provided with large amount of informational material from the device manufacturers, which you can take home, study, and make your decisions with your endocrinologist once you're at home. This gives individuals and families early exposure to what these technologies are and how they work at a high level and what options exist, so they can begin considering whether CGM use and pump therapy or both might be something they want to explore later on without any pressure to decide right away. These decisions are typically followed up on after discharge with the individual's endocrinologist or their primary care doctor or whichever doctor that they use at their home for diabetes management, since prescriptions and insurance approvals are required in either case. Carbohydrate counting is introduced so people understand how food affects blood sugar and how mealtime insulin doses are determined. This typically starts with the basics: identifying carbohydrates, estimating portions, understanding glycemic indexes and serving sizes, and the difference between fast-acting and slow-acting carbs, and learning how insulin and food are matched and how they interact. Managing low blood sugar is treated as a critical safety skill. People learn how to recognize that a low is happening and how to respond quickly and safely. Managing high blood sugar is also covered at a foundational level, including the idea of correction insulin and why hydration and monitoring matter. Basic sick day rules are also introduced. This includes the idea that illness changes insulin needs, increasing monitoring requirements, and may require extra insulin to hydration and ketones. Detailed sick day management is typically covered more fully after discharge and will be addressed on its own in a future video. Support and psychological care are also part of the hospital experience. Many families meet with a dietitian to help translate nutrition concepts into everyday meals and routines. Social workers, psychologists, or child life specialists may be involved to support emotional adjustment, help process the diagnosis, and address concerns related to fear, stress, and the immediate impact of the diagnosis. As the hospital stay comes to an end, attention turns to discharge planning. Follow-up appointments are scheduled, care teams are established, plans for school, work, and daily life begin to take shape. Prescriptions, supplies, and points of contact are reviewed so individuals and families know where to turn once they leave the hospital. This video serves as an anchor for, as I said in the very beginning, a larger series focused on the hospital stay following that original initial diagnosis. Each video that follows will focus on one specific topic so each piece can stand on its own and can be revisited and paused whenever needed. Before wrapping up, and as a disclaimer, the content on the T1D Academy YouTube channel is for informational purposes only and should not be interpreted as medical advice. I am not a doctor nor a healthcare provider. Everything shared here is based again on lived experience and personal perspectives only. please consult with a qualified medical professional for diagnosis, treatment, and individualized medical care. Until the next video, take care of yourself, take care of each other, and remember, you've got this. And as always, Liam, 143AI +1. Take care.